If we look at the structure of the tooth, you've got the enamel on the outside, it's like a hard structure, and then you've got the dentine and you've got the nerve on the inside. Now, everywhere else in the body, a nerve's like a white stringy substance you see it on an anatomy program, but in the tooth, it's a blood supply. So once that blood supply dies, bacteria get inside that chamber, we call it the pulp chamber, and none of your immune system can get to it. Quite early on, I remember we had a mouth-body links lecture, and it was very early evidence, but we were worried if an unhealthy mouth could affect the heart. And I remember really closely thinking, it's not just about teeth, this is about the body as a whole. This patient's mouth could implicate the rest of the body, it could affect the heart, and over the last 20 years, more and more evidence has come to light of how the mouth can affect the rest of the body. So really straight away, that was one of the first sort of eye-opening hints of how I was going to be.
So could you talk me through some of the research that you've looked at and how important this microbiome in the mouth is?
So we've got the oral microbiome. It's the second biggest biome after the gut. There's 700 different types of bacteria in the oral microbiome. We're a superorganism. We're a mixture between the bacteria. We've co-evolved and we've coexisted over millions of years.
Welcome to The Wellness Way with me, Philly J. Lay, a layperson's guide to your natural health systems, your very own NHS. Hello, lovely people, and welcome to another episode of The Wellness Way. And today's guest, I am absolutely thrilled to introduce you to, because I went to see him at his practice last week, and it was a mine of information. So without further ado, I'm going to introduce you to Dr. Daniel Sutcliffe from the Bespoke Dentist. Dan, thank you so much for coming on the show.
Oh, it's been a pleasure to be here, to spend some time with you. It's great.
It's been lovely. And I came to see you last week, and my God, it was an eye-opener, because I've seen a lot of dentists about the problems that I've got in my mouth, which all stemmed from 2 amalgam fillings that I had when I was 16 that I didn't need. And we're going to come on to amalgam fillings and everything later. But for the first time since I discovered amalgam fillings and how bad they are for you, I actually have the confidence to know that I am in such good hands, and we're going to sort my teeth out. So bless you for that.
Oh, no. You were a pleasure to treat as well.
Oh, thank you. So the first thing I want to ask you is, you're a dentist, and then what was the trigger for you that kind of went, do you know what? This isn't quite working for me as a dentist, and I think there are other routes that we can look at and go, because there aren't many holistic dentists out there, really, in all honesty.
No. University, to be fair, I was quite quick onto it. So 20 years ago, we did all different types of subjects at university. You do the first couple of years and you're learning how to do a fill-in, how to do a crown prep. Quite early on, I remember we had a mouth-body links lecture, and it was very early evidence, but we were worried if an unhealthy mouth could affect the heart. And I remember really closely thinking, it's not just about teeth, this is about the body as a whole. And that was a massive wake-up call. I was early 20s, I was a student, going through the motions. And there's a seriousness, which I'm not particularly serious most of the time, but there's a seriousness that really hit me. And I thought, hang on a minute, this patient's mouth, this patient who's my patient, this patient's mouth could implicate the rest of the body, it could affect the heart. And over the last 20 years, more and more evidence has come to light of how the mouth can affect the rest of the body. So really straight away, that was one of the first sort of eye-opening hints of how I was going to be. And I think some of the tutors possibly thought, oh, you're going to be one of these hippie holistic dentists. It was the same with it was the same with amalgam as well. I remember we had a lecture and they're saying, well, when you place in an amalgam, we can get mercury vapor coming off. And when you're drilling an amalgam, or when it's in, if the patient's grinding the teeth or biting the teeth together, there's an amalgam vapor can come off. And straight away I thought, well, I actually really don't want to place this. So that was one of my first worries. It's like, I don't really want to place the amalgam fillings. And then the next worry was, I actually don't want to drill through it. So if a patient comes in and they've got a decay underneath the low right 6 and there's a big hole, I have to drill through the amalgam to access the hole. So I thought, not even just for me, for the patient, for the nurse, we've got no evidence at all that mercury or anything from amalgam fillings could cause us any harm whatsoever, any definite evidence. But have we done a trial which can definitely prove it? Just because there's no evidence, the way I look at it, if there's something as a concern, I try not to use it. So with my instincts, I thought, well, if there is a concern, and I'm like that with everything in dentistry, if there's any concern, I don't want to use it. So this sort of concern about materials that are used, how a practice, how the mouth's linked with the body, was kind of from the outset, really. Sort of first, second, definitely third year at university.
They must have loved you.
I asked a lot of questions.
I'm sure you did. I mean, I've seen studies where mercury in vaccines is a neurotoxin, causes damage. And so, without hesitation, when I learned about mercury and amalgamams, I needed to get mine out.
Yeah, and I think I was the same,
Yeah, but it has caused me endless problems, which we are still, I'm paying the price for. But this discovery of, this microbiome in the mouth and the connections to the whole body, because, that is one of the big problems with Western medicine, is they don't connect the body anywhere. And certainly
Absolutely.
They don't connect teeth to the body.
Nope.
So could you talk me through some of the research that you've looked at and how important this microbiome in the mouth is?
So we've got the oral microbiome. It's the second biggest biome after the gut. There's 700 different types of bacteria in the oral microbiome. It's an unusual microbiome because there's so many different surfaces. You've got the teeth, you've got the tongue, you've got the inside of your cheeks. So it's very complex as well. The mouth is the window, it's the gate, it's the start of the digestive tract. I know a lot of people try to separate it, but we're completely connected. The mouth is completely connected to the rest of the body. We can't have anything in isolation, it's all connected. And there's some pretty vicious, I know it's not a scientific term, but some pretty vicious bacteria present with with virulence factors which can have far-reaching implications. So 20 years ago, it was like, is it a common risk factor? Is it the periodontal disease, for all the listeners, is a gum disease where we've started to get some bone loss? Is it the sort of patient that gets periodontal disease has got the same risk factors to have other problems like the heart disease? Is it a risk factor thing, or is it an actual connection? But as the 20 years has moved on, we've started to think, well, actually, this bacteria, which we think just stays in the mouth, it doesn't, especially in periodontal disease. It can easily get into the blood supply and it goes around the body. We can swallow it. We used to think the stomach acid would kill all the bacteria. There's one called P. gingivalis we know often goes through. So now we're very much at the point going, actually, this bacteria in the mouth is travelling. And there's a lot of links. Diabetes is one where there's quite a lot of research. It's a two-way street. If a patient of mine about 18 months ago came in, not seen a dentist for years and years and years. He's really honest. I pick apart the medical history. I think you probably found I did it with yourself. And he just said, I've got diabetes. It's uncontrollable. I can't keep the blood sugars. So as soon as I looked in his mouth, this huge periodontal disease, I said, do you know there's a link? And he didn't. And invariably, that's common. People don't realise. So then it's making sure we can treat that mouth as well as we physically can, because it will affect other things. So it's not just diabetes, there's a two-way street there. Rheumatoid arthritis. We are starting to worry about Alzheimer's. A bacteria called P. gingivalis releases different chemicals, and we think it could cross the blood-brain barrier, and it could contribute to Alzheimer's. There's a load of things that could contribute to Alzheimer's, but that could be one of them.
Yeah, I heard that amalgam and fillings contributed to Alzheimer's. Doctors are now beginning to call it type 3 diabetes.
Yes.
We know that there are neurotoxins on the brain, that it's clogged up.
Yeah.
So, it really isn't a great idea to get those put in your mouth. But if you've got them in your mouth, if you've got amalgam and fillings, what's the best way to get them out? How do you find somebody? Because I phoned loads of dentists, and you are the expert in this. And Dr. Sarah Myhill, who's a great friend of the show, she's been on 3 times. I know that she's written about you in her book.
Oh, that's
she has referred patients to you for 15 years plus, hasn't she?
Yeah.
So, you are as good as it gets.
Oh, thank you.
The ultimate, the pinnacle of dentistry. But for Joe Bloggs, as I was when I wanted to get my fillings out, I didn't know where to look.
It's so hard. So there's an International Academy of Oral Medicine and Toxicology. It's called the IOMT. And this was a saviour for me. Just after university, I was thinking, I don't really want to drill through the fillings. I'm scared. So there's a set of protocols. So we cover your hair, we cover your body. You have your own air supply. We have dams inside the mouth. So I even hire air purifiers are in the surgery. I mean, they clean the air 25 times an hour in the surgery anyway. But we have something called the flex back, and it sits underneath your chin. So as we're drilling, it pulls the air away. So anybody on the IOMT's list, so you have a normal member, and then you have a member for the IOMT Smart, so the smart members. All of those should use the IOMT's procedure. And do you know what? Some dentists may think I'm over the top, and other dentists will message me on Instagram and go, do you know what? It might be a bit over the top what you do, but if you're not causing any harm, I do see why you'd use all these precautions. Because the old way of drilling amalgams out is like a diamond burr. We want to section it into chunks, and we want to remove them as safely as we can. Especially if you've got a hole under 2 amalgam fillings. For me, why not put a dam on? Why not cover the hair? Why not cover the body? Why not take all these extra precautions? So that's the first point of call. There's another level above called accreditation. There's 3 in the UK were accredited, and this is where we've done a little bit more sort of research and exams on all different types of amalgam removal as well as holistic dentistry. So if you can find an accredited one, amazing. If you can find a smart one, definitely. I mean, we treat people from all over the country anyway. Europe. A lot of our patients live in the Middle East, believe it or not. So
where?
people in the Middle East.
Oh, really?
So people travel.
Yeah.
So because we can often, if we can see X-rays before people come in, we can look at what treatment might be needed. I can speak a lot on the phone about before that we get the patient in. So we can often do it in reduced sessions.
Gosh, that's extraordinary. I have to say, there was at one point where I was despairing because I hadn't heard of you, and I was despairing, and I nearly flew to America to do it because to me it was so important to get it right. And then I thought I'd found somebody in London, and when I walked in and I kind of said, oh, where's all the air, that I'll be breathing and everything, he said, oh, well, I'll just open the window.
Right.
And I'm like, okay, you're not who I thought. But I didn't like to say anything.
Patients often don't. I think that's the big problem.
I was in there and I kind of thought...
You're lying back.
Yeah, okay, let's just get on with it
What
then.
do you feel as though you can say when you're sort of lying back?
Yeah.
I get that. I absolutely get it. And people might say I'm over the top, and I'm happy to be over the top. I'd much rather be that. So the IOMT was a saviour for me. When I was sort of thinking I don't really want to touch it in a certain way, I want to be careful. And I always state we don't have any sort of scientific double-blind definite research, but I can imagine it's very difficult to research. But why not take precautions? I just think it's commonsensical for me. That's how I view it.
Yeah, I completely agree with you.
Yeah.
So I had mine out, and now both of the teeth that I had, the fillings changed over, have cracked, and I've lost chunks of them. Now, you x-rayed my mouth, and I have a huge amount of bacteria, don't I, here on what is a dead tooth, because you sprayed, what temperature was it?
Minus 50.
Minus 50 on me. I went, did you feel anything? I went, no. You went, that's dead then. Yep, that's dead then, minus 50 degrees.
I sort of looked down and put it on, and you can see the eyes, and as soon as the eyes aren't moving, think they've not felt any. You touch it very gently, and your eyes didn't move, and looked down again, and your eyes didn't move again, and then it really pushed onto the tooth, and you just went, I thought, oh yeah, it's very much dead.
Very much dead.
Yeah.
So I left it in there because I've kind of got rid of the pain.
Yeah.
And I just felt it looked better.
Yeah.
It was black, but I've done some oil pulling and it seems to have lost that kind of blackness. Yeah. So I kind of thought, well, just leave it there. But when you x-rayed, what did you see in my mouth?
Well, if we look at the structure of the tooth, you've got the enamel on the outside, it's like a hard structure, and then you've got the dentine, and you've got the nerve on the inside. Now, everywhere else in the body, a nerve's like a white, stringy substance. You see it on an anatomy program, but in the tooth, it's a blood supply. So once that blood supply dies, bacteria get inside that chamber. We call it the pulp chamber, and none of your immune system can get to it. Nothing, your immune system can't get to it. So what had happened is the bacteria flourishes inside the nerve, and then it comes out underneath. We call it periapically. It's underneath the apex. So when I x-ray, I could just see a huge dark area underneath your apex of your roots, and that's an infection. That's that dark area of infection. It could be like it sounds awful to say, but it's like a bag of infection which is attached to the bottom of the root. And people say,
God,
my
it's
immune system
gross.
can deal with it. Your only immune system can only deal with it on the border of where the bone meets the root. It can't get inside because there's no blood supply. When the tooth really is healthy and it's working as it should do, the blood supply comes in, delivers all the immune response like it does everywhere else. It's fabulous at healing. But as soon as that's dead, then there's no blood supply, so there's no immune response. So all it is a place where bacteria can flourish and then flourish and flourish. So that's why we need to...
I mean, you did say
Yeah.
to me you must have one hell of an immune system. And with the kind of infection you've got in your mouth, I should have apparently come in to you.
I was
looking
amazed
like
he didn't have a swelling because it was
Elephant
huge.
Man.
Yeah. Because usually when you look at it, you think, have you had a history of swelling? And people say, it did swell up. Last Christmas it sort of swelled up and then went back down again. But you hadn't really got any history of that.
No.
But, yeah. So as soon as, sometimes you always say the swelling can come at any point, but especially if your immune system's down or it's fighting elsewhere. Our immune system is like our army, isn't it, defending us?
It
so
is.
if it's too busy fighting in one area, it does leave other areas unprotected. So
Yes. So this is what I discovered with you and alarmed me.
Mm-hmm.
So what I thought would cosmetically look better has obviously got to come out because
Yes.
it's draining my immune system, isn't
Absolutely.
it? That's
Yeah.
basically what it's doing.
Yeah, and the bacteria is flourishing.
Yeah. So what do I do once it's taken out? So taking it out is, there are a couple of ways that
Yeah.
you don't do this. So,
I tend to refer to oral surgeons.
yeah. So I'll go to an oral surgeon. There is an oxygen therapy you can have, isn't there?
Yeah, so there's ozone you can do. There's all sorts of ways you can do it. In my mind, with a lot of dentistry, I always use specialists. So a lot of patients go, why won't you do it, Dan? If somebody's got a problem with the gums, they see a periodontist. If somebody needs a tooth out, I do some extractions, but if there's anything complex, I go to an oral surgeon. If there's orthodontics, I prefer an orthodontist to do it. I think dentistry is often best where the specialists are doing the treatment because it's what they do all day. And if they're going to get the tooth out, they'll probably get it out and take it out much easier than me, a general dentist. So I'm a big fan of specialists in all areas of dentistry, not just extractions. You're just seeing somebody who deals with that all day. Patients like, no, but I want you to do it. It's like, well, this person's better at it than me because they do it all day. It's not what I do all day.
Yeah, I'll take your fillings out.
yeah. Do you want your fillings removed or anything? Then I can do that for you.
So the reason that I didn't do it, again, always comes back to looks for me.
Yeah.
Once it's
like it
out,
does everyone.
what about root canals? What are the options? How safe are they? I mean, I remember seeing a study many years ago, which I don't know if you're aware of, or maybe it's disproven or now, I don't know. But it was to do with root canals and a correlation to breast cancer. So have you ever seen that study?
Well, and it wasn't of the highest standard. And that's the problem. We want to be able to prove things scientifically. So when somebody does a trial and there's no control, like the biggest thing, I think it hit a lot of the papers, I think it was about 10 years ago, and there's no control. So it was looking at all these people with root fillings and all these horrible illnesses going, it's the root fillings with it. But there was no control about the people that had these horrible illnesses without root canals. So I never close my mind to anything. And it's going back to the tooth where we know there's a blood supply which has died. Once you've filled it with it, what I tend to do is because there's a practical aspect to it as well. If you've got somebody and they've lost the front tooth, they're 19 years old, they smashed the front tooth and it's either a root filling or a £5,000 implant, the patient's like, we've got to be practical. In an ideal world, I possibly wouldn't do any root fillings. If we could press a button and a new tooth would grow, you wouldn't even consider it because with a root filling, you're trying to fill where the blood supply was, basically. But it's an incredibly complex blood supply. So you've got loads of lateral sort of canals, which are tiny, they're microscopic. So I've used ozone down there in the past, and I've done root fillings myself. But if somebody is going to have a root filling, and make sure you have a top specialist doing it, because that's what they all do all day. They'll use a microscope and they'll fill it as fully as they can. The downside is, you can always get some sort of infection. So I do understand the argument, people saying, look, I don't want it, Dan, because it could be a potential for argument. But we do get patients like yourself, and even patients when you've told them there's an abscess, they just leave it and they go because they don't want a root filling. I was like, well, actually, that's worse, because at least with a root filling, top specialists will cover a lot of the root canal system and stop it getting reinfected for a good percentage. But when you've left it, it's 100% infected.
Explain what a root filling is.
So you drill into the tooth. So say we were talking about the blood supply. There's like different canals. So there's up to 3 to 4 canals in the back teeth, 1 to 2 in the front teeth. So what we tend to do is drill down the canal where the blood supply was, and we put a filling in basically in the canal system. It works in the fact that it can stop you getting infections again, and especially if it's done really well. That dark area, which we discussed before, will then heal back to the bone. And the body's very good at telling you when something's worked. And you can see the bone levels will heal back to the root. I know it when some people say, oh, it isn't the most ideal. And other dentists, especially in America, there's a lot more dentists in America, maybe more anti-root canal than they are here. And they'll say, yeah, but Dan, there's always some sort of infection. And I do get that. There will always be some sort of infection. But sometimes it's a practical aspect as well, because not everybody can afford, if they've got smashed 3 teeth, to have 3 teeth extracted and £15,000 worth of implants. So there's a practical solution to it, and I think that's what I always try and say to patients. It's that practicalness. It might not be ideal, but what I would urge people, if you do need a root filling, because again, do see a top specialist, because they are more likely to be able to clean it out and fill it as best. I may think I'm good at root fillings, but I'm not going to be as good as a specialist.
Okay. And so a root filling is different to a root canal?
Same thing.
It's the same thing.
And a lot of people think, oh, so what's the difference? It's the same thing. The root filling is just a filling inside the root canal.
Okay.
But loads of people say that. They go, I don't want a root canal, but I'll have a root filling. It's like, oh, they're the same. So it's a filling in the canal.
Right, okay, that cleared it up for me.
It's quite complex though, isn't it?
Complex.
Yeah.
It is complex. Yeah. And, it's... The other thing you noticed was I actually had to have a filling on the surface of one of my teeth. So what was going on there? Because I actually didn't realise that you could do a filling on the surface of your tooth. I always thought they went...
in the top.
Yeah.
The latest composites are brilliant because they bond, but it's called an NCTTL, so it's non-carriers tooth tissue loss. So on the outside of the teeth, you can lose teeth from abrasion, which can be overbrushing. It can be bruxism, which is a type of grinding, and then that creates a cavity called abfraction. So it can create wear and almost like V-shaped cavities, and that's what you had. So then what we do is we build up the composite, and it looks great as well because you can't tell.
You can't even tell it's there. It was just like I looked and I can't actually see what tooth you've done it to.
Well, I do cheat a little bit because there's a new form of composite which is BPA free and classic monomer free, but I don't know how it works. It must be some sort of weird system, but you don't need, in the old days you'd have to match composite shades, you'd be mixing all sorts of shades together, but this actually just matches the tooth, whichever, so it's one composite and it seems to fit all different types of teeth. So I can cheat a little bit now because all I do is use that material rather than mixing loads of composites like I've done in the past.
Yeah,
so that's why you can't tell.
Yeah, I can't. Yeah. I really can't tell because I had this done on some teeth for my wedding actually, because I had a couple of little gaps, and now that's changed colour substantially to my tooth. Yeah, and it doesn't clean up and it doesn't come back.
The stain composite is brilliant, but it isn't as long lasting as some of the ceramics, and that is the downside.
This was just like, oh, I can't believe this is going on here. I can't see it. And honestly, I can't tell you how excited I was to find you.
That's brilliant. And it's a nice thing to do because people see it straight away and they go, oh my God, I hated the look of that. Oh, I couldn't stand it. I could get my fingernail in now.
Well, it was sore. Yeah. It was really sore.
It's the outside of the teeth, you see, because the enamel's worn away and the dentine's there.
And the thing is that I was... We'll edit that. Oh, sorry.
No, not at all.
And the thing is that I misunderstood what it was. Mm-hmm. So I was actually cleaning it more and more.
Everybody
and more.
Does that.
I was doing kind of 2 minutes a day just on that one tooth, on top of my tooth clean. So
and then
I
it
was
causes
actually
an abrasion, even worse.
Yeah.
And so patients always do that. They go, "Oh, Dan, I've not seen you for years, and I've had a problem here, so I'm really brushing it for you. So I promise you, it's as good as it can be." And then you look and you go, "You're actually wearing your own teeth." Especially with some of the abrasive toothpaste can wear. We've got to be careful because some of the holistic toothpaste can be quite abrasive as well. But then it can also be, I think, with yourself, you've got that grinding aspect as well. We call it bruxism, so it's holding your teeth together.
You had a little look in my mouth to see if I had marks on my cheek from grinding. I wasn't too bad, you said.
Just very light marks.
Very light marks. But I am aware that it's more not grinding, it's clenching.
Holding together.
That I do.
Yeah.
And I find myself sometimes doing this. So obviously...
And other people catch you. They go, you're doing it. Especially if I tell a husband, and the next time they'll come back in, my wife keeps poking me going, I told you you're doing it now. So sometimes you don't realise, and it's somebody else seeing it or hearing it during the night, going, what are you doing with your teeth during the night? It's a noise. So, and then that puts the pressure on the outside of the teeth, and it wears the outside of the teeth.
And what can you do for teeth grinding?
So there's a couple of things, and one of the big things what I look at, a lot of bruxism, which we call it, we used to make splints for it, and we still do. So it's to take the pressure off. So as you bite your teeth together, it pushes your teeth apart or pushes your teeth forward just to try and reduce it. But as we are, this is another thing that I feel about mouth-body links. We're starting to realise it's a lot of sleep problems causing bruxism. So there's so many patients, especially now because they've watched videos on Instagram, they'll come and say, Dan, I've had a splints for all these years. And then you realise there's a sleep apnea or a snoring. So we're starting to realise that snoring and sleep apnea can be affecting how that person's grinding the teeth. And you make them the bite guards, and you are helping them. And it can be not to do with sleep, but sometimes you then treat the sleep, because you can make these different devices called MAS devices, and they move the mandible forward. And then that creates more space, so you're less likely to snore. But then once you've treated the snoring or the sleep apnea, patients come back and go, I'm not grinding my teeth anymore. So we're actually starting to realise there's another root cause further backwards.
Okay.
And in the last sort of 5 years, when I've been saying to patients, going, so how do you sleep? And they're like, looking up at me. What are you on about? What are you asking? I've come to have a look at my teeth done. I've broken that tooth.
I know.
Why are you asking me about sleep?
I know. I mean, this is what I found so interesting and fascinating with you, because everything was talked about in the connection to the whole body. You mentioned BPAs just now,
yes,
saying that it was BPA free. So, we all know, I think, that BPAs are not good for our body, that we apparently eat about a credit card's worth of plastic a week now in our diet, and especially people drinking from water bottles and everything. So that's another minefield. Can you talk us through what might have BPA in dentistry?
Certainly the composites. What
you've got to be very aware of.
Yeah, certainly the composites and some of the lutein cements as well. But it was, again, really early on, it was like BPA was talked about, and it was a bit like anything. If something I don't like, I just think, well, I'm not going to, if there's a concern, I'm not using it. So very quickly I got BPA-free composites, and some of the earlier ones were harder to place, didn't look quite as good, but especially the one I use now called Admira Fusion. It's a brilliant composite. It looks great. I find it really easily to place. And even if dentists don't, after a good 3 to 6 months of using it, you've just, like anything, you just get used to it. So there's no classic monomers, there's no BPA, and I think, well, I might as well use it, because if something's a concern, and I think that's where dentistry is, if something's a concern, even if there's not definite causative evidence and there's only light correlations, or even, then let's just avoid it if we can. I'd rather do that than in 20 years somebody go, there was a problem with that. I think, I've always thought that. You might as well avoid it.
Yeah, exactly. So I think that's really good advice. I want to talk about fluoride, because that is something that personally I feel very passionate about.
Yeah.
You spoke briefly about toothpaste earlier. So I use a fluoride-free toothpaste. I've had Joy Warren on the show from the Fluoride Free Association, who described fluoride in water and toothpaste as a medical intervention. That's how she has described it. And it has been registered as that. Now, you're not as hard on fluoride as most people I know. What are your thoughts on it?
Do you know what? So with the fluoride, again, it's the concern thing. So it's a powerful ion. We know it's a powerful ion. And before hydroxyapatite, it's a type of toothpaste. It's a mineral which is already in your enamel. It's 97% already in your enamel. So we talk about biocompatibility, like with the composites. You want something as close to the tooth or as the body as possible. This is biomimetic, means it's already in there. So the hydroxyapatite toothpaste I recommend now, there's a company called Risewell I love, and it's already in your enamel. So 97% of the enamel is, 70% of your dentine is, which is the next layer down, and 60% of your bone is. So we are starting to see that some of the trials of it is working just as well as the fluoride. So if we can't avoid it, because if you were to just look at the enamel of a tooth and put a fluoride iron on, forget the rest of the body, I know we shouldn't, but just for this, it does make the enamel stronger. So you're less likely to get decay. But my worry or concern was, well, will it affect the oral microbiome? I don't know, could it affect anywhere else in the body? But we know it's a powerful ion. You think, well, actually, if there's an alternative, which is now in my mind, and the research is getting that way, it's emerging, it's nearly as good or as good, and especially if the patient's got a good diet anyway, then you think, well, actually, why not use hydroxyapatite? It's more microbiome friendly, because we talked about the microbiome before. There's good bacteria and then there's bad bacteria. And a lot of people, it used to be a disinfect in the mouth, didn't it? We'll kill 99.9% of the bacteria using this mouth rinse, and you'll be completely disinfected and clean. That's the last thing we want, because the commensal, which is the good bacteria, helps to protect your mouth. So the last thing we want to do is kill all the protections, because it's the commensal bacteria that help protect your mouth, and they can kill the bacteria, the bad bacteria, they can block physical space. So what we need to be using in the mouth isn't disinfectant. And fluoride can be very antimicrobial, but we do know now, and we are learning more and more, that hydroxyapatite is completely oral microbiome friendly, and it's very favourable with the pH of the mouth, because it's when the pH of the mouth is going to a certain pH below 5.5. It can vary with kids and with different surfaces, but that's when we're starting to get decay. So if we've got a material which is more biomimetic, looking as though it's nearly as effective, it's certainly not more oral microbiome friendly, why wouldn't we swap across? So that's how I feel. And now we can get it in floss. Like, I had an IG live with one of the owners of Risewell last week, an American, really respected American dentist. He's brilliant. And they've got it in floss. So, and even some of the mouth rinses have got, I've always been quite anti-mouth rinses.
I've always been very anti-mouth rinses.
You don't want to disinfect.
Well, yes, because you are killing all of that beautiful microbiome. Yeah. As you said, there is good microbiome in there as well.
Yeah, we're a superorganism. We're a mixture between the bacteria. We've co-evolved and we've coexisted over millions of years. We're not a separate entity. We're connected. We're together with the bacteria, as weird as that sounds.
I do have a mouthwash I use, though, but obviously none of that very stringent alcohol and all that rubbish in it. But I use the Neal's Yard one, which is just lavender and myrrh.
Yeah, and I think it's more balancing, because I think that's where he went with the Risewell. He wanted to keep it more balancing, so you're not putting anything which is going to kill any of the commensal bacteria, but you're not going to put anything too acidic in your mouth.
And by putting the acidic into your mouth,
you're more towards decay.
So coming back to fluoride a little bit, because it still is a huge concern for me. If you look at the back of a toothpaste packet with fluoride in it, especially for children, a pea size, it could be enough to kill you. That warning is on toothpaste packets.
There's a lot going on in America. There's there's a trial in America looking at water and the fluoridation. So there obviously is concerns, because in America they are looking at the water fluoridation and could it affect, and I know the IUMT, that organisation which I'm part of, they're very instrumental in this and they're looking at it. So people are looking at it more closely. And I think because we're trained to look in the mouth, and it's always like, we need to stop decay, because decay can be horrific. You're referring a 7-year-old to GA to be put to sleep, to have 6 teeth out. Honestly, there's nothing more. It's heartbreaking. You go home at night, your stomach's churning, you think, oh God. And fluoride was stopping that, and that's the thing, because from a dentist point of view, because I can imagine if I step out of my dentist, I would feel exactly the same as you. I'd be like, why would we even dream of it? But because you step into dentist and you think, that little 8-year-old I referred to have 6 teeth out, and you think, well, if she'd have had fluoride teeth, would that have changed it? And then you almost sort of, you beat yourself up. You think, well, I did speak to the mum about fluoride. I did say what we need to be careful. And then you almost beat yourself up. Have I done the right thing with that child? Because your patients, you adore, you know them, you've treated the families. So are you doing the right thing? But now there's a contender, hydroxyapatite, so why not use it?
Yeah. So there is a very, very safe alternative now. Yes. It's something that Bobby Kennedy spoke about very much on the run-up to the election with Trump, was getting fluoride out the water. He's very adamant that it should go. A lot of people are. you know,
and that's linking into this trial. It's just, it is linking in, and I know there's always updates.
You know, one of the saddest things I find that, you know, if you have got a patient, a young, you know, a child that's got to have all those teeth out, you have to be asking the parents what on earth they're eating.
I do diet diaries, so what I tend to do is I'll say, I know this is funny, but will you tell me exactly everything that's been eaten for 7 days? Don't lie. Don't just cut everything. Just tell me, honestly, just approach me. I understand. I'm a father myself. Just come back to me and show me exactly what you're eating, because a lot of it can be very hidden as well. And there's so many patients that come back and go, I didn't realise, because refined carbs can be just as bad. It turns to sugar in your mouth.
Yeah.
And then anything acidic, so anything you're having which is acidic, especially anything chewy, anything which is getting stuck between the teeth, anything which is sour because it's bringing your acidity down. So not all are as bad as each other. Some are a lot worse. So sometimes it's the education. I think that's what we need to be doing, and that's what I try and do with my patients. I sit them down and say, look, I know you've come to have a filling, but this is what I want to talk about. And then it's really saying, you do realise the sticky sweets was just sticking between your teeth. You do realise, what type of sweets, if you are going to have a sweet, I'll have the sour ones. Well, that's going to make it more acidic. Or there's, you know, that's good. We need to swap that. We need to get rid of that. And we need to, on this type of bar, this type of refined carbs, this type of cracker. And it's like, well, this, and quite often parents, they can be, I didn't know, Dan. I really didn't know. So I think it's sometimes hard. I mean, I started the Zoe thing, and I think it is quite hard to know, to be able to eat really healthy and avoid things like sugar, especially for an average family with 4 kids and both parents are at work. It's from a practical, it's not easy for them.
I mean, I was of that first generation, really, where you come home from school and there would be these kind of treats like Angel Delight in the cupboard, and you make yourself a bowl of Angel Delight. I mean, I grew up on the land and the food was really healthy, but then these treats started coming in when I was about 8 years old. And Mum go, oh, look what I've just found.
But I think it was normal. You know, from school you go to the sweet shop. You know, they have
the
old jars, and
the big jars.
You'll have a quarter of that, and it was, everybody from school did it. It was like you saw all your mates in there. It was completely normal. So it is a lot better. A lot better. I see a lot less decay now than it did 20 years ago. So it's absolutely improving. It's definitely better. And I think people are a lot more health conscious now anyway.
I think they're waking up. I think we are at, you know, with everything that's happened in the last 5 years, we are at a moment of history where people are questioning everything. So they're questioning all the traditional dentistry, medications, you know, everything that's going on.
Yeah.
And they want to know now.
It's great to question. And there's nothing wrong, because like other dentists I've worked with in the past go, your patients can be difficult, Dan. They're asking everything. But I love that. If somebody goes, you know, what about this and what? It's nice to question, because it's when you're questioning it. Is because ultimately, when somebody's asking a lot of questions, they're taking control of their own health.
Yeah.
And I know full well, it's like my wife books patients in, and she'll get a message, and it can be we'd have a WhatsApp scheme. So rather than having to ring, people just WhatsApp and they can get answers back on a Saturday night. But it'll be, Dan told me about the upper left 7. I'm starting to get a bit sensitive. And Liv will go, how did they know it's the upper left 7? But it's lovely because I've spent a lot of time explaining their oral health to them.
Yeah.
And I adore that, and I adore the new way of people wanting to know and wanting to learn and wanting to understand about their own health. I talk about sleeping. The amount of people go, I've got an aura ring like I have. Have you? And they, I've noticed I'm not sleeping brilliantly, and that was one of the things I wanted to bring up with you. So it's nice that it's
aura
turning.
Ring.
Aura ring. So it just looks at how you're sleeping. So this is always
seen one of those.
It's always monitoring my sleep, and it monitors my heart rate variability, and they're not as accurate as you'd want them to be. Like I'll wake up twice during the night, and it'll tell me if I've had the best night's sleep. And I think, well, I know I was up twice, and it's not registered that, but it does give me an overall. And so many of my patients, they're all either on the Zoe, they've got an auras. Maybe it's the type of patients I treat as well. I think that's the ones coming to see me.
I mean, I'm not sure about the Zoe app either. I have to say,
but they're all trying to learn. And I don't mind the learning, but I do get what you mean. Yeah.
I think it's a little bit data harvesting myself.
Yes.
And so I'm not a big fan. Anyway, I'm going to come back to where we started with the microbiome in the mouth. Mm-hmm. We've spoken about fillings. We've spoken about root canals. you've got this beautiful little garden
Yes.
in your mouth. Now,
Yes.
in Ayurvedic practitioners, they will always have you, and I do it, scrape my tongue 3
it's
times
essential.
every morning.
Yeah.
How important is it?
Absolutely, for loads of different reasons. So I always say to patients, have you thought about, no, I've not, I haven't got time. I was like, okay, just do one thing for me, just for 2 weeks, add it. Because when people say they haven't got time, if you do it for 2 weeks, it's amazing after 2 weeks you get completely used to it. And they'll go, do you know what, Dan? It's all gone clear, and now they can't even leave the house without doing it in the morning. It has to be done, and the amount of patients come back and my mouth feels so much cleaner. You get plaques of bacteria on your tongue, and you don't want to do it too hard, but some of the bacteria at the top can then block some of the more commensal bacteria underneath, so it's getting rid of that plaque. And it's also the nitric oxide, and I don't know whether you've had other guests on who've maybe talked about the nitric. If we breathe in through our nose, you get that wonderful nitric oxide. It reduces your blood pressure, which is, ironically, going back to the mouth rinse thing, there was a trial done, and it was people using certain types of mouth rinses, the blood pressure was going up. But there's bacteria on the tongue that create nitric oxide. So when we were killing that good bacteria, of course, the nitric oxide wasn't going into the system and reducing your blood pressure naturally, so people's blood pressures were going up. It isn't the best trial, but it's certainly pointing us to a different direction. But it's the same with tongue scraping. It's cleaning that plaque off the top and letting nature do what nature's doing and what nature's co-evolved to do, to release the nitric oxide and to be able to have your bacteria in your mouth need to be nourished, not disinfected. But cleaning the films off the tongue is invaluable. And patients, my mouth feels so clean, Dan.
Do you know, I kind of thought it was rubbish. I thought this
a lot of patients think the same.
And I used to, and I think actually it's still written in my book, that the first thing I always did when I woke up in the morning, well, meditate, but the first movement that I did was pick up my glass of mineralized water and drink that straight down, flush out my mouth. But I can't do that anymore because I have to go to the bathroom and scrape my tongue, because I think otherwise I'm just drinking all of that back down into my body.
Patients always say it, and once they've started, they will not stop. And like, there's one lady, she's lovely. She's particularly something, she's not doing it. It's like, fine. But I really spent a lot of time. And she came back and she goes, I've got a metal one, I've got a travel one. So if I'm going to bring, and she's gone from completely the opposite, because she goes, it's just how my mouth feels.
Yeah.
No,
I mean, I have a
would it
copper
affect
one.
Taste as well?
I have a copper one because
Yes,
copper is antibacterial, antiviral, antifungal, all the rest of it. So it's great. How often do you wash yours?
I regularly, because I'm I don't know, a bit of a clean freak, so pretty much every time I use it, I just clean. I sort of.
Okay, let me quantify that. So I obviously rinse it with my finger every time. But would you ever put it in the dishwasher? Do you put fairy liquid on it? Well, not fairy liquid, because you wouldn't want that shit near your mouth. But
I've tried boiling water and other things as well, just really hot water. But there's all sorts of cleaners that you can use as well. So we sometimes use them for, like, if we are making somebody a splint or making somebody a bite guard. There's all sorts of little, like, you can get them on Amazon, like little cleaners, and that can really help, like with an effervescence, and that can help clean. Because it's metal, it would be fine. But there's a lot of people with plastic ones as well, and they always ask how to clean it.
Oh, would you put plastic in your mouth and do that?
No,
I'm sure I would.
It's patients do it for travel, for ease, but in one way sometimes it's lovely, because you know the patient's really taking it. And I find if you get somebody, because my next thing is big thing is flossing. One of the IG Live I did last week with Derek, and the Americans are maybe a little bit more ahead than us. They do a lot more flossing. I think one of the trials about 4 or 5 years ago, it was only about 35% of the UK population floss, and it's so important because everything's in between your teeth, and you can think about the bacteria. You brush the top, the outsides, and the inside, but the amount of bacteria between the teeth, and the disease-causing bacteria is massive.
I know. I'm really,
but it's harder.
Really
not everybody likes it. Try different ones, because when I get patients that say, do you know what, Dan, I can't do it, it's like, just go to a supermarket and buy 5. I know it sounds awesome, just buy 5 different types, different widths, different types. It's like, I use one of the Risewell's ones, and it's a scrubby one, and as you go in between your teeth, it expands, and there's hydroxyapatite, and my God, your teeth feel so clean after.
Hang on, it expands with what?
With water. So as you're putting it in, it's got hydroxyapatite in, but as you put it in, it expands. It must be something to do with the saliva, so it expands a little bit. So when you're cleaning in between your teeth, you get a whole new clean. And as geeky as that sounds, it's like when you leave in the bathroom in the morning, you're like, yeah, they're clean.
Okay, I will look into
So
those.
try a load of different types, because one might work well for you but might not work for others.
But again, it's one of those things that it's quite hard to get clean ones. So I use a tea tree one.
Yes, yeah.
But I'm really bad. I kind of do it once a week. And I know that Barbara O'Neill, who's a great friend of the show, she always quotes on her lectures. I can't remember who she quotes, but a dentist who says, only floss the teeth you want to keep.
Do you know what? And it's true. And if we're then at the point where we started, where I was saying your mouth-body links, if we're at that point where we know that anything that's going on in your mouth could impact on something, whether it be a systemic problem like rheumatoid arthritis or diabetes or any of these things we've mentioned, then flossing becomes even more important, because gingivitis is the inflammation of the gums, but as it progresses and you get bone loss, that's called periodontitis. So it's it's like 3.5 billion people in the world. So it's virtually a huge part of the world's population has some sort of gingival problems. But once it progresses to periodontitis, which I think is like 1 in 10 over the world, I don't know exactly, but it's around that sort of figure, then it's your oral hygiene on a daily basis, the flossing, the tongue scraping, the brushing, the seeing the dentist, seeing the hygienist regularly, because you're going from this gingivitis to this dangerous part where you've got the periodontal disease. The gum's like a girdle that goes around the tooth. So as soon as you get the breakdown of that girdle and the bone levels start to drop down, that's when these particularly vicious bacteria in the mouth can then get into the blood supply. So I know it's saying on staff, but it's the little small simple things that have a huge collective effect. So the flossing every day, the tongue scraping, it can prevent patients going across to that. So if we know mouth and body are so linked, the health of the mouth can't be just good to not lose teeth. To keep it, it has to be perfect. Because in effect, I always think this with my patients, the patients have to have perfect oral health, because I don't want that to affect any of my patients medically or systemically. It's not just about losing teeth. The floss is kind of that important, and I absolutely agree with that statement.
I do as well. It's just trying to find time. But
I'm
going
to.
I've got to ask you, one thing you didn't mention there on cleaning the mouth is oil pulling, which again is another Ayurvedic practice, really important. Do you oil pull?
I've done bits of it, and I don't think you need to do it for quite as long. So again, it's something we haven't got a lot of evidence for. And a dentist a couple of years ago criticised me because I didn't condone it it was sort of burnt at a patient saying, it's like, I don't condone it, because there is some there's a light study which showed it did reduce some of the bacteria adhesion. And I honestly, when patients come in and I'll look and go, do you oil pull? And they go, yeah, because I'm actually for it. But I always say to patients, we haven't got any research on it, not enough to say it definitely needs to be done, but I'm absolutely not against it, because there's a definite flush and there's a definite clean, and it can't be a bad thing, because as far as I'm concerned, because we are keeping things cleaner with that flushing action. So it's got to be good, and if it is reducing some of the bacterial effects, I'm not against it. And other dentists have sort of half criticised me, saying, well, you should be against it because we haven't got any evidence. But I don't necessarily it's causing any harm. The only thing is sometimes people do it instead of flossing, and that's I always say to them, don't rely. If you're going to do it, I'm not against it, but not opposed to flossing. And patients are like, you knew I was going to say.
I knew. Oh my god!
But that's what I always say to patients.
Question.
I always say it not as opposed to flossing. So I'm for it, and I'm not bothered with patients doing it, because I actually can't see it causing any harm.
Okay,
but not instead of flossing. That's the only harm it could do.
Yeah, I could get away with not flossing because
it's common though. That's a question I get all the time.
Yeah. And the other thing with oil pulling that we have to tell our audience is, do not spit it down your sink or your loo, because it will block it.
Yeah.
You've got to put it in the bin. And it's fractionated coconut oil that I use.
Yeah.
I have one with peppermint. I have one with charcoal, which is great. I also have a little charcoal pot next to my sink where I can just brush my teeth after I brush them with some charcoal. Yeah. Again, charcoal is something that is very much used medically for the gut. When you've got an upset stomach or something, you will have charcoal. So if you're, just putting some charcoal, cleaning your teeth, will that clean up your...
Can be, but it can be abrasive. So one of the things, I use charcoal with amalgam removal. One of the IUMT regulations is after we've done the amalgam removal, have a charcoal rinse. It's a binder. So patients will often leave up our surgery with a bits of a black mouth. But it can be abrasive as well. So that's the only downside, because some of the problems we do see in dentistry can be just as much with abrasion, and that's the wearing of the outside of the teeth. And some of the holistic toothpastes can be very abrasive. So that's one of the problems I see quite a lot is the abrasion. So it all depends on how it is and the way it's put together and whatever you're using, but it can be abrasive.
Yeah,
it's not nothing. None of this is simple, is it? It's
no,
so hard
none of
to
it's simple. I'm pretty sure that what you did there is because, I was
certainly have
using quite an abrasive toothpaste for a while.
I see it quite a lot.
So say the name again for me, because I cannot pronounce this.
Hydroxyapatite.
Hydroxyapatite.
That's it.
Okay.
And it's a natural crystal. It's in your body already, all over your body.
Yes. So I've only just discovered this. And when we were chatting and arranging you to come on the podcast, I sent you an Instagram post and said, "What do you think of this then, Dan?" And you went, "It's marvellous." And I'd never heard of it.
A lot of patients haven't, and I'll bring it because patients go, "Oh, I don't want to use fluoride." And there's no fillings in the mouth. They have no problems. And they say, "Look, I've never had a filling done. Why am I using fluoride?" Okay. But they went, "What would you recommend?" And I bring up, and they're like, "I've never heard of it." And it's like, "Oh, well, it's what's already there anyway." They look white. Have you whitened your teeth? Have you been somewhere else? But it does give you a bit of a whiter look.
That was in the advert that I sent you, and I kind of thought, well, it's got to have something really dangerous in it. When I was younger, I used to have my teeth whitened, and as my children kind of turned into their mid-late teens, they were going, "Oh, I need to have my teeth whitened," and I'm kind of going, "Oh," because there were some really nasty chemicals I now know about in that. So, but it was something in my youth I did. So, but this.
Hydroxyapatite. No, loads of patients.
Hydroxyapatite.
Yeah, loads.
Hydroxyapatite.
Yeah,
okay.
think hydroxy
Learn
and then
that,
apatite.
everyone.
But everybody's the same. The amount of times people come, it's the and it's like hydroxyapatite, because it's a funny thing.
It is.
To say,
It's very, and it
But
is just completely natural.
Completely natural.
In your teeth.
Yeah.
Whitens your teeth.
Yeah.
Stops the need for fluoride.
Yeah. Oral microbiome friendly.
It's a win-win, isn't it?
And I think this was one of the things that really helped me. As soon as it's been around for a long time, though, the Japanese have used it for decades, and it was originally a NASA thing for scientists.
Why have I never heard of it?
Well, do you know what,
you're saying
haven't.
Most people haven't, but this is my job.
But I'm such a huge fan of it, and if you can get it in floss, and you can do it with to me, it's a nice, viable alternative. And people will say, from a scientific point of view, it's never been proved as it's effective as fluoride, but it does seem to be getting more and more effective. And especially if somebody's got the diet sorted, there's no problems with saliva flow, because there's loads of reasons you can get decay. It's the diet, but there's also saliva is a very important buffer. So if there's a problem with saliva flow, but if you've managed to get everything else sorted, you've got good saliva, the diet's good, then I'm happy for hydroxyapatite. It's amazing how quick, and a lot of people are scared of going to the dentist. There's all that worry and the fear, isn't there?
I think that
We
comes from
understand
watching. For me, it comes from watching Little Shop of Horrors.
And I know you can tell people when they come, you can almost see from their eyes as they get to the bottom of our stairs and they come, you can see the nervousness. So I always spend quite a lot of time before I get anything to do with dentistry, because I always find the more they know me, and I give bits about myself, I'll talk about my wife or my daughter or what I do at the weekend, football team, sport, anything really. The more they know the person, they can relax easier, and once they're relaxed, treatment's easier. People trust you. They know you're likely to, you're going to do the right thing by them, and when they get to know you and you've got that bond, treatment's much slicker and easier. And people go, "Oh, Dan, it was effortless. It wasn't a problem. It's not something which caused me stress, and I won't be nervous next time." Time's a big factor, and I think that helps patients.
Yeah, I felt very, very at ease with you. And when you did this filling here, and it was a little bit sore, and you kind of said, "I can give you some local anaesthetic," and I went, "No, thank you."
You just did it?
I just trusted you, and I tapped, and I started singing.
Yeah.
And I just kind of thought, right, I'm just going to connect the vagus nerve, do a bit of tapping, and you made me feel so relaxed and safe and secure. Bless you for that.
That's amazing.
You're in central London.
Yep, central
Bespoke
London.
Dentist.
Harley Street. A little place, a little cobble street is part of Harley Street called Harley Place.
It's beautiful.
And as you know, it's so peaceful. You don't feel as though you're in central London, do you?
It's beautiful. And I parked just round the corner.
It's amazing, isn't it?
I know, it's really easy.
And do you know what, on a Wednesday night, I'll often stay out, because I often stay over and we'll do work, and so I can't hear anything. I think I'm in central London, so it's very quiet and peaceful.
It is. And you're on Instagram.
On Instagram, yeah.
Give us your handle.
Yeah, it's the Bespoke Dentist, and it's London LDN at the end.
So
With
go
the
and
lowercase
follow.
into it, yeah.
A great account. I'm loving following you, Dan. I can't
Thank
tell you.
Same either way, definitely.
Thank you so much for
Yeah.
coming on the
Oh,
show.
I've loved being
We've
here.
unwrapped a lot.
Yes.
We've had to kind of touch on every subject quite quickly because that's our time. But it has been wonderful, not just to interview you, but to meet you.
It's the same. I've loved being here, and it's lovely to come here and spend time.
No.
It's been brilliant.
Dr. Dan Sutcliffe, Bespoke Dentist. Until next time, lovely people, remember, the doctor of your future is you. Thank you.
That's brilliant.